All right, Saagar, what's on your radar?
Well, our country is in a dire situation. The number of coronavirus deaths yesterday passed 2,300, quickly approaching the death toll from the 9/11 attacks. Dr. Fauci, the National Institute of Health, said, quote, millions of Americans will contract the virus, and that somewhere in the range of 100,000 to 200,000 deaths can be expected while all this is said and done. So what's shocking is not just the death toll from this virus, but it's the complete inability of the CDC, of private industry, seemingly any other institution in our country to respond with the urgency needed. We don't have enough ventilators for the number of patients that are expected. We don't have frontline healthcare workers. They don't have protective equipment. The number of tests that we've run of this country relative to the rest of the world is pathetic. And as we question how exactly this can happen in the richest country in the history of the world, the answer is becoming incredibly clear. It's neoliberalism. Let's start with the tests. The only way that Crystal and I have argued that we can get out of this mess is we have enough tests to basically test anybody in this country who needs one way that we can isolate the sick and we can trace everyone who has come into contact with that person. Well, over the weekend, Dr. Michael Osterholm, whom you might recognize from his appearance on the Joe Rogan podcast, co-authored an op-ed in the New York Times, which shocked me. He writes, along with his co-author, quote, any public health response that counts on widespread testing in the United States is doomed to fail. Why? Well, he explains that in 3 to 4 weeks, we won't be able to run the limited number of tests that we even do have because of a shortage in chemical reagents. Now, the shortage in reagents, well, it's, quote, the result of limited production capacity, compounded by the collapse of global supply chains when the epidemic closed down manufacturing in China. In other words, we're screwed. The only avenue out of lockdown was widespread testing. And according to these respected epidemiologists, it turns out that right when we need the capacity the most, we won't have it. Because Republicans and Democrats over the last 40 years decided that efficiency was more important than being able to build anything in America with American workers. Now, let me give you another example. You've heard a lot about ventilators and the need for more, how General Motors and Ford and others seemingly incapable of building them, despite promising the U.S. government they could. It turns out the U.S. government gave a grant to a small medical device company about a decade ago to try and drop the price of a ventilator from $10,000 to $3,000. And after a few years of trying, a small company actually succeeded. So much so, the CDC was excited. Right around that time, a company with $12 billion in annual sales called Covidien came in, swooped them up for $100 million. They pretended to keep the ventilator project alive, but they ended up basically killing it over the next 2 years. Why? Well, government officials told the New York Times they believe Covidien intentionally bought the company and quashed the project in order to protect their existing costly ventilator business. Offshoring critical supply chains, allowing consolidation in our medical industry. These were things encouraged and pushed by both parties for nearly 2 decades. And now, chickens are come home to roost. It will literally kill people. We can't stay inside forever. But it turns out we can't test. Millions will get sick. Hundreds of thousands will require a ventilator. Well, you're SOL. Because our FTC and our CDC, they weren't watching our backs whenever it all mattered. And from the beginning, we've noted that the coronavirus crisis has revealed us for what we are. There's no better example. The 2 things we need now, more than ever, we cannot produce at the drop of a hat because of 40 years of neoliberal thinking among our experts. And when we forcibly shut our economy down, we immediately swept in to give $4 trillion in aid to bigger corporations, while small business owners and workers get a paltry $1,200. Has Congress learned anything? Did they take the opportunity to give them money and change corporate behavior, make them move supply chains back to the U.S.? You already know the answer. If anything, their bigger and richer firms are only going to get bigger and quash more things, like maybe cheaper ventilators. And it's an enraging story, isn't it?
Unbelievable.
To learn about consolidation. And by the way, Covidien was later bought by Medtronic. So, another multi-billion-dollar health conglomerate, which was Irish in the first place. So, it just demonstrates exactly what this whole thing was about, is that this larger company comes in, kills a cheaper ventilator product, which we could have used to bolster the national stockpile, and even now, mass produce them, because it could have been cheaper. A current ventilator costs 10 grand. The parts come from 14 different countries. Very hard piece of equipment to build. Same thing on the tests. Literally, you can't do the tests. If you don't have the stuff to do the testing, it's all in China. China obviously is, either not shipping it out or they literally have to use it all on their own patients and cases. We are completely vulnerable. And you see this happening in New York State. and all across America, where these ER doctors and others are like, please, please, give us masks, give us masks. One thing I didn't note is that Michael Osterholm in that op-ed says, forget it, masks ain't going to happen. 3M is producing 35 million masks a month. Well, in the month of February, a single hospital in New York City used 2 million masks.
Oh my gosh.
So we're done. It's over. There's no, I mean, this op-ed really freaked me out because it's bleak. It was just, there's no tests, there's no masks, all of the things that we need that we've talked about here.
And they're not coming.
And it's never going to come.
Yeah.
And so
don't live in a fantasy land thinking that, okay, we're going to be able to test everybody and quickly get back to some level. No, we have to shut everything down because
they failed us, because they decided that it was better to float an economy on debt, on efficiency, which is, it's so much more efficient to have on-time delivery for hospitals so they can just get stuff 2 days, right before they run out of stuff. How'd that work out?
Right, until a crisis hits. And then, of course, the profit center of the healthcare industry, which, has put sort of like elective surgeries and those types of things and things that are profitable rather than drugs and care that is actually needed to keep people healthy in this country. Instead, we've centered everything around profit. And you really come to see it. I don't know if you saw this headline that if you have a lot of people who are hospitalized over coronavirus, which, looks pretty likely, insurance premiums could go up 40% next year.
Yeah, right.
40%. I don't remember having that "how will you pay for it" conversation during the Democratic primary debates. Meanwhile, you also have, last week, 3.3 million people filing for unemployment insurance. That means they're going to be separated from their employer-provided health care. So all of these things that we were told were so great, so good for us, that, improved all of our prosperity, et cetera, it was all a lie. And that was the thing is, why was this course of action, this sort of neoliberal worldview, market-centric worldview embraced? It was because there was a theory, or there was at least propaganda around the idea that a rising tide would lift all boats. That just like in the post-World War II era, when you did have a sort of flattening of income and a broadly shared prosperity, that was just going to continue forever, that was the norm, when in fact the norm is ever-increasing inequality if you don't have government policy to deal with that. So that was all a lie. It would be one thing, life is full of trade-offs. It'd be one thing if outsourcing everything overseas actually did build our middle class.
Yeah, but it
actually did bring prosperity to the masses. Yeah. But it didn't do that. And it left us incredibly vulnerable, not just to this shock, but any number of shocks that could hit our economy, that could hit our healthcare system. And so the only people that it really benefited are, the very top. Not even, the 1%, but really like the 0.1% massively benefited from this. And if you look, even with something like a pandemic that, yes, it hits everybody, but the rich are able to cost it and protect themselves much more so than the working class in all of this. They know they're going to have their concierge health care. They can hole up in their country home in Connecticut or the Hamptons or wherever. They can order all the delivery that they want. They don't have to be out there delivering packages or working in the warehouses or being on the front lines of the healthcare system. They don't have to do any of that. And so even if you look at the map of New York, you can see a poverty differential. You can see that in the harder hit boroughs and neighborhoods are the poor and working class neighborhoods. The rich people are getting off unscathed.
Yeah, Manhattan, they're doing just fine. It's all the outer boroughs and the edges
Queens
of
is the hardest
and
hit.
All that, which is all these people who still have to work. I see it. I can see it in the city. The whole city of Washington, D.C. is food delivery drivers going in and out, exchanging things with people because they need the money. And I talk, Uber drivers, because we still get to come to work. And it's like they're telling me that they're making less than minimum wage. This is the hardest they've ever been hit. They don't know how they're going to pay their bills. It is a terrible situation, and that's what it's revealed. I actually think that this has revealed even more about our economy. So much of what we've been talking about for so long, which is that the post-2008 recovery, the boom, all of that, it was fake. It ultimately was. Because what it was is it took people away from stable work, separated them also from their wealth, and turned them into like a rentier class of people who are like, they pay money up to their landlords. They get money in from gig work, which is very uncertain. Fine when, there's growth going like this, whenever wealth is concentrated very much at the top and being distributed in pittances to the bottom, but enough to still keep people shaky. And then when something like this drops out from the bottom, who are the people who are most vulnerable?
Yep.
All of these gig workers, all of these people who after 2008 had to cobble together a couple minimum wage jobs and all these other things to meet maybe 60% of the wages that they used to get. That's gone. And pay rent to a landlord despite the fact that they used to own a house. That's millions of people.
Right.
And that's what we're seeing now is that's why when we talk about, people are like, oh, what are you talking about, Saagar? $1,200 payment plus unemployment, all of that. That's a lot of money. That's $3,000 a month. All this. I'm like, you don't understand how much debt these people were already in.
Right.
Is that they were already struggling just to make it on a day-to-day basis. And whenever you push them more and more and more to the edge, and look, the president yesterday saying in the press conference, I think it was Dr. Fauci saying this thing could last until June 1st. June 1st shutdown. Look, this is the week. April 1st, it's coming this week. Millions not going to be able to pay their rent. Not just people. Businesses.
Right.
Cheesecake Factory and Burger King not going to pay their rent.
Right.
There are people across.
Jared Kushner's not paying his rent.
Right. There are.
He's making his tenants pay their rent, but he's not paying his.
Well, that's part of the thing too. Is that there's no money going up in the financial system, and I think I covered this on Friday. This could be a real housing crisis. I think this whole thing is just going to reveal what we really are. We're a nation who's incapable of building anything. We can't produce for ourselves in a time of national crisis, and it takes a long time to spin this stuff up. And people are literally going to die because of it.
It's all been a house of cards. Next on Rising, New York Magazine columnist Josh Barrow says that stimulus package looks okay for now. He joins us when Rising continues.